Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Jani, and with me is Dr. Graeme Marchuk, who is a neurosurgeon at Thunder Bay Regional Health Science Centre, Thunder Bay, Ontario, Canada. Today we are going to talk about brain tumors. Statistics say that at this time 55,000 Canadians are living their life with a brain cancer or brain tumor. Every day 27 Canadians are diagnosed with a brain tumor. And as per the statistics, brain tumor are the leading cause of cancer-related deaths in children less than 20 years of age, now surpassing acute lymphoblastic leukemia also. Brain tumors are different types. There are more than 120 different types of brain tumors, which can be primary or secondary. Primary tumors can be benign or malignant. And so many different types of brain tumors leads to confusion in diagnosis and treatment for the physicians as well as for the patients. Hence, understanding the brain tumor is very, very important to cope up with the disease. And today, Dr. Graeme Marchuk is going to enlighten us about the different types of brain tumors with their diagnosis, treatment, and what are the prognosis options available. Thank you, Dr. Marchuk, for coming to the show.
Glad to be here.
I know you're very busy, but you have taken the time, and we really appreciate it. And all
No
the
problem.
patients who are watching this show will get benefit out of it. Please tell us about different types of brain tumors. What are the different types?
Yeah, well, like you said, excuse me, it's a broad category of disease, and I think that you've done very well to classify the tumors into two categories, primary and secondary. So that's often how we'll think about the disease process initially. And so a primary brain tumor would be one that originates within the brain tissue itself, comes from the brain cells or from the supporting structures of the brain, like the lining of the brain. And like you said, those can be benign or malignant. And then the secondary tumors are ones that have spread from another source in the body, like the lung or the breast or the colon. And so that's what we call metastasis.
Metastatic tumors, right. So at some point in time, the primary tumor from the, say, breast or colon or lung, they will likely to go to brain as a metastatic tumor, right?
Yeah, and it's not every type of primary cancer that will have a proclivity or tendency to do that. There are certain ones that have maybe a higher tendency, most common being, say, lung and breast.
Right.
Those would be then probably the number one and number two types of metastatic tumors that we see. But yeah, that would be the manifestation of that primary disease.
Now, what type of tumors we see in the children, like benign or malignant common? What type of tumors are common in children?
You can see both, and it depends a little bit on the age of the child and when they present with their disease. Unfortunately, the younger the child tends to be the more aggressive malignant types of tumors. Yeah, so in the toddler age group, we'll often see these rather horrible type things like a medulloblastoma is a common type of tumor that occurs in the back part of the brain, or what we call the posterior fossa. And so those tumors are aggressive types of tumors that tend to require like a multidisciplinary approach to management. The older you get, you're more likely to have more of a benign process.
Right.
Yeah.
Now, among the benign tumors also, there are different types of benign tumors, right? And they are graded as per the WHO 1, 2, 3, and 4. So please help us to understand the different grades of the tumor.
Sure. Yeah. So what you're speaking about there, the WHO World Health Organization classification. So that's a histological or under the microscope classification of tumors. And yeah, we use that to grade primary brain tumors, the ones that are arising from usually the supporting cells of the brain. And so we'll broadly call those gliomas. And that comes from a word, glia, which actually means glue, because in the old days they thought that the extra cells that weren't nerve cells were just this glue that was holding the nerve cells together. And it turns out that there are many different types of glial cells, and they all have important roles. And the most common type that leads to tumors are the astrocytes, the star-shaped cells in the nervous system, and so we call those astrocytomas. But they broadly all fall under the category of glioma, and so what we're talking about there in terms of the WHO grade, a WHO grade 1 tumor would be the lowest grade, and that is a benign tumor. So the type of tumor that might fall into that category would be something like a pilocytic astrocytoma, which is a tumor that we'll see in younger
children.
Yeah, that's right. So typically that tumor, once it's resected or treated, it generally won't come back or has a very low rate of coming back.
Right.
And then there are other types of that grade of tumor that we'll see that have weird and wonderful names, but we see them fairly uncommonly.
So grade 1 and 2 are benign tumors?
So a grade 1 I would certainly classify as being much less worrisome than say a grade. Once we get up to grade 2, we call that a low grade glioma. That's sort of the grade 2 would be a low grade. And that sounds benign, and initially it is, but the problem with those tumors is they always have a tendency for future transformation, to change over time into something that's more malignant. Yeah, so it's not quite a benign disease in the sense of, I don't have to worry about this again, I have a benign tumor. It's something that we have to follow, it's something we have to watch, and some of them we treat because even the low grades can have significant pressure effect or swelling effect on the brain or cause seizures.
Right. So now all these tumors, primary brain tumors, grade 1, 2, 3, and 4, and we see them in spectrum of ages from children up to the older age, and as the age increases, they become more aggressive, as you said.
Yes.
So what are the factors which causes the brain tumors? What are the risk factors?
Yeah, that's an excellent question. There are actually surprisingly few risks to developing a brain tumor. Most of the tumors we see are spontaneous in origin. Presumably there's a genetic change in one of the cells in the brain tissue, and that leads to the cell behaving mischievously, growing and invading tissue and spreading and multiplying in a way that it shouldn't normally behave.
So genetic cause might be the cause in the young children?
Well, what I'm getting at is that that's the underlying primary thing that leads to the formation of the neoplastic tissue, the tumor tissue. But what induces that change in the cell initially, it's not in most cases there's no clear relationship to some sort of environmental factor. The only definitive ones are certain types of tumors will potentially have a positive family history. For example, there are what we call inherited tumor syndromes, like a condition called neurofibromatosis. That's a genetic condition that's inherited in the family members, and those patients in particular have a proclivity to develop certain types of tumors of the nervous system. And then radiation, but not the day-to-day radiation that we experience in the world, treatment-related radiation that you receive. Yes, that's right. So children, for example, who receive heavy doses of radiation of the nervous system for leukemia as a child, they'll have a higher risk of developing tumors in the future.
So family history of brain tumor, as you said, so somebody's family, first degree relative has a brain tumor. Do they have to take a special care about it? Actually,
no. The other members of their family are very unlikely to develop tumors. That's most likely to be a spontaneous event, unless they were known to have one of these inherited tumor syndromes.
So they don't have to worry about getting the screening or the genetic testing or anything like that.
Yeah.
Right? Now, we were talking about different causes. Is the cell phone radiation a cause of tumor?
Yeah, I thought that question might come up. That's been bandied back and forth in the literature a bit. There's no definitive data that indicates that the cell phone will over cell phone use or excessive cell phone use, whatever that might be, would lead to the development of a tumor. There's still some investigative work into that, but I think we can still keep using our cell phones for now.
As we are using.
Yeah.
Thank you, Dr. Marchuk. We'll take a short break and we'll come back. Please stay back for the next part.